Hello and welcome to this video for elite outdoor fitness with bulletproof bodies. In this video we're going to talk about iliotibial band compression syndrome. So this happens to a lot of people that are tabbing or running because we tend to dissipate weight on the outside of our bodies. So what happens is that we've got a muscle right at the top of the hip here called tensor fascia lata, and then we've got another muscle here, the glute medius. And these muscles feed into this very thick band. It's about 4 fingers width, band of fascia that goes all the way down here and inserts into the knee. And that's called the iliotibial band or the iliotibial tract. Now, there's lots of controversy about iliotibial band compression syndrome because it normally manifests as pain on the outside of the knee, and is probably the most common thing I see, and it's also associated with runner's knee or infantier's knee, this lateral knee pain on the outside. The pain isn't coming from the knee, it's coming from the hip. And what happens is, because we tend to sit most of the day, the tensor fascia lata gets a bit short and tight. Combine that with lots of tabbing and running, and all of a sudden we need to trigger point this muscle. Imagine, you can see on my trousers there, if I pull this way, it's pulling the fascia that way, pulling the fascia anteriorly. If I pull on the fascia this way, it pulls posteriorly the other way. So generally what happens is tensor fascia lata is tight and glute medius, the other muscle, is not doing the same amount of work unless it's specifically trained. Now these muscles do 2 things really, and there's a little rhyme that helps you remember that. So tensor fascia lata, gluteus med and min, help abduct the femur. That means lift the femur out to the side, take away from the midline, and then rotate it inwards. Okay, so they rotate inwards. So abduction and internal rotation. Very important that we understand this. Glute medius generally needs to be worked on specifically for pelvic stability. Tensor fascia lata tends to get short and tight. So how do we treat that? Well, I use the myofascial wand, and I'm going to use the edge of this, but you can use, I don't know, a broom handle, okay, a mop handle, anything like that. Basically you're going to get into the muscle. So you're going to lie on your back with your knee bent, and you're going to get into the muscle with your thumb first so you can feel where it is. And if you take your knee out to the side, you'll feel that muscle, and if you turn in, that muscle will just pop out. That's your tensor fascia lata. That's where the end of the broom needs to go. So I'm pressing in there, okay, and it should be quite significant pressure. I'm feeling some discomfort there, and then all I'm doing is I'm just sliding my heel away, super slow, as I'm compressing into that muscle. So we're lengthening while we're getting right into that trigger point there. I just turn my foot in right at the end. That's cheeky. I take that off and I do it again. Find where the muscle is, internally rotate. That's exactly where it is. I put pressure on there, down into that, bit more pressure this time, maybe using both hands, okay, and all I'm doing is I'm slowly sliding the heel away, nice and easy, nice and relaxed. I'm in discomfort the entire time, but not pain. Yeah, I know I'm not in the pain cave, and I'm slowly extending the leg there. Right at the end, I just turn the foot in and relax. Okay, so there you have it. That is a nice quick way of doing some emergency repairs and avoiding iliotibial band compression syndrome and that pain on the outside of your knee, runner's or tabber's knee. Now it's your turn. Go and have a go.